Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and content here on our YouTube. Also, you'll be able to support us here on our YouTube channel by hitting that like and subscribe button. And also, as a gift for you for subscribing to our channel, you can hit the link down below in order to download a free healthy meal recipe that we do have here on DamiRx Care. Thank you and bye-bye. Hi there. So what is our medication of choice today? Our medication of choice today is known as Factrel, or a brand name also called Lutrepulse. So this medication is known as the gonadotropin releasing hormone, and it comes in those two brand names as I mentioned earlier, which is Factrel as well as Lutrepulse in patients who are experiencing hypogonadism. So hypogonadism is basically a condition whereby patients have lower sex hormones, and which could also be affecting patients in terms of having a baby, conceiving, and so on and so forth. So this medication is actually used as 100 microgram intravenously or subcutaneously as a single dose. So it comes in an injection, and it's usually given in the first or early follicular phase of your menstrual cycle, which would be like the day 1 through day 7, and usually given during the follicular phase, which is day 1 through day 7 of the menstrual cycle. And this is usually given when the menstrual cycle phase has been established in the patient. So what should you know about this medication? So some common side effect of this medication is lightheadedness. So this medication can also cause flushing and as well as abdominal discomfort. It can cause skin rash, nausea, as well as headache. So making sure that you're looking out for these common side effects that can happen in patient. If it becomes consistent, then you definitely want to report to your doctor immediately when you start noticing these abnormal changes. Also, when it comes to this medication, a serious reaction that patients have noticed while taking this medication will be what they call ovarian enlargement or hyperstimulation syndrome. So usually with this syndrome, patients start feeling stomach bloating or swollen stomach, which is like gassiness around your stomach. Also, patients may feel lower abdominal pain, or severe pelvic pain, as well as shortness of breath. Patient may notice like a decrease in the amount of time they pee, which is like a lower unusual amount of urine that you're getting all throughout the day. Making sure that you're reporting this is very important. That way they can make sure that it is not due to this syndrome, and that way the doctor can know the next line of therapy or treatment when it comes to you being able to conceive, as well as stopping any serious side effect that may occur when it comes to this medication. Also, if you start noticing any abnormal increased weight gain, then you definitely want to report that to your doctor as well. All right, so with this medication, you don't want to use it if you are pregnant. So like I said, this medication is used in patients to induce pregnancy. So it kind of defeats the purpose if you're already pregnant and then you're taking this medication. Also, you want to make sure that you're continuing your doctor's appointment. That way they can order and place the important lab works that are supposed to be done while you're on this medication to see what the hormone level is in your body, and just to make sure that the medication will be able to work effectively with lesser side effect as prescribed to you. Also, this medication can increase your risk of having more than one baby. So you can increase the risk of having a twin or quadruplet. So these are things to be aware of, or triplets to be aware of while you're taking this medication. Also, this medication can increase the risk of what is known as ovarian torsion. And ovarian torsion is a condition whereby there's a twisting in the ovary, which actually stops or obstruct the blood flow into the ovaries area. So we don't want that in patients who are trying to conceive. So you definitely want to make sure if you start feeling any of the side effects that I mentioned earlier, such as the lower abdominal pain, the severe pelvic pain, you definitely want to report that to your doctor. Also, in terms of taking this medication, you want to make sure that you're limiting your workout. This is not the time for you to have any, for you to be doing any rigorous, intense training. When it comes to your body, you want to make sure that you're getting your body prepared to be able to nurture, the fetus, and to be able to, accommodate for that. So you don't want to, involve yourself in a rigorous training whereby your body is burning so much energy, is having lower chances of even recuperating and being able to, accommodate the conception period. So also, when it comes to this medication, you want to make sure that you're washing your hands before and after, and also making sure that you're disposing of your injections properly. The last thing you want is for someone else to come in contact with the syringe that you actually used in injecting yourself. Also, when it comes to this medication, you want to make sure that you're discarding the needles, like I said, in the sharps disposal box, and making sure that you're discarding them properly. Also, with this medication, it can increase the risk for blood clots, such as chest pain. So signs of blood clots will be chest pain, abdominal pain, a weird headache. So signs of blood clots will include severe leg pain or leg swelling, a severe headache, chest pain, eye pain. So these are signs or symptoms of blood clots that you definitely want to reach out to your doctor for immediately when you start feeling those side effects. Also, if you start noticing any symptoms of ectopic pregnancy or miscarriage, these are also some things that you want to make sure that you're mentioning to your doctor. I would include a visual of what an ectopic pregnancy or miscarriage looks like in this video for you to be able to see and kind of have a visual in mind when it comes to that. All right, I hope you were able to enjoy this video. If you did enjoy the video, make sure you give it a like, thumbs up. Make sure you also subscribe to our channel just in case we have similar videos coming up, or any video of any medication that you might currently be taking that you're requiring more information about. This would be a great time for you to subscribe. Thank you so much for watching, and if you would like to consult with some of our pharmacists here at DemiRx Care, then you definitely want to go over to our website, which is www.demirxcare.com. All right, thanks for watching again, and stay blessed.